Staffing. Have you ever been part of a team, a good team, where everyone was able to work together and fulfill their roles? As part of a team, have you ever had players who weren't able to show up, making the workload for everyone else a whole lot heavier and your day a lot more tiring? If you have, this video is one that will help you understand the impacts of poor staffing on the wards of hospitals and how they're affecting both patient safety and a healthy work environment. My name is Spiteri and I'm a third-year nursing student completing the UTS subject of Leadership for Beginning Practice. This introduction is to give you a background of the issues surrounding staffing on the wards and what is being done. The video will also cover how effective leadership may mitigate the problem and what your responsibilities as a new graduate nurse are. The aim of this presentation is for you as a new graduate nurse to gain a greater understanding of how you can help mitigate the issue of staffing. The reasoning why I have chosen to present the information in the form of a video is that it supports visual learners through the images, auditory learners by listening to the information given, and also those who learn best through reading through the text on the slides. I'm sure that everyone has seen on the news here and there nurses petitioning for better staffing and fairer ratios. This is because with better ratios, nurses are able to take better care of their patients that they've been assigned, and also have a much healthier work environment. Staffing issues on the wards both compromises patient safety and ultimately leads to nurse burnout and high turnover, which then has a domino effect and creates poor staff skill mix. Currently, the New South Wales government isn't doing much to help and support nurses with this issue. In 2018, the New South Wales Premier rejected the Health Minister's request for formal nurse-to-patient ratios. Such ratios have already been legislated in other Australian states. Both Queensland and Victoria have already had these ratios. This was made legislation 2 years ago. New South Wales is lagging behind. The New South Wales Nursing and Midwifery Association are fighting for ratios to become legislation in New South Wales also. They run campaigns and rallies at New South Wales hospitals to improve staffing. Now, some of you may ask, how is this relevant to nursing practice today? As I mentioned previously, staffing issues affect both patient safety and a healthy workplace. Let's start with patient safety. Here are the facts. By increasing a nurse-patient load by just one patient, the risk of respiratory failure increases by 53%, and the likelihood of pneumonia increases by 7%. The chances of surviving lower by 5% for each additional patient added per nurse in medical surgical units. In plain English, these statistics show that with fewer nurses to a higher amount of patients, there is a lead in an increase in complications, readmissions, and length of stay. Such ratios are also associated with a higher mortality rate and an increase in medication errors. Hence, staffing is obviously an issue in regards to patient safety. Let's move on to a healthy workplace. An increase of one patient per RN was associated with a 7% increase in the odds of burnout, and the nurse's intent to leave also increased. An increase of one patient per RN was also associated with an 8% increase in job dissatisfaction. Approximately 82% of RNs reported one or more activities being left to the next shift due to a lack of time, and 25.6% of these tasks were necessary. These statistics demonstrate the extensive impact of staffing on nurses. They show how nurses are more likely to burn out, have the desire to leave the profession due to dissatisfaction in their job when their workload was increased by a single patient. It also shows that when wards are understaffed, nurses are unable to finish the tasks assigned that shift. Now that we understand the importance of staffing on both patient safety and the nursing workplace, let's have a look at how effective leadership can allow for the mitigation of the problem. First of all, what is a leader in nursing? Nurse leaders are nurses who have a vision, are confident, self-aware, and are able to motivate others. These leaders can improve health status of patients, increase motivation of fellow colleagues, and improve levels of job satisfaction. So, by having effective leadership on the wards, nurse retention is increased. By increasing the retention of staff, there is a drop in the number of turnover, which is linked to an improved quality of care of patients and an increased inpatient outcomes. By retaining skilled staff members, the issue of skill mix is able to be met and also that of high turnover. The transformational style of leadership in nurse unit managers has also notably lowered patient mortality. This style of nurse unit management allowed for the retention of staff, which in turn created a safer working environment that promoted satisfied and high-performing staff, ultimately leading to the establishment of adequate staffing and resources to avoid unnecessary deaths. However, it's not only managers who can be leaders. All nurses on the floor can be leaders, inspiring each other to be their best. As a new graduate nurse, we too can be leaders. However, it is crucial that we work within our scope of practice and always ask for help when needed. The worldwide nurse staffing shortage has been an issue for several years now. Nurses are experiencing workforce shortages which have been exacerbated by an increasing demand and an aging workforce. As I've mentioned previously, these staff shortages create problems with patient safety and maintaining a healthy workplace. Nurse staffing levels have clear effects on the ability of the nurse to provide safe care for the patient. With more nurses available, patients receive better quality care, which result in better outcomes. Improving staffing on the wards is crucial to improving the healthcare outcomes of approximately 7 million people who are admitted to hospital each year. Of those admitted, approximately 50 people die daily, and 140 sustain injury as a result of their care. Hence, there is a need for urgent action to ensure that patient safety and high-quality healthcare is met. In a study, it was found that new graduate nurses may lack in communication and practical skills. This study accentuates the needs for us as new graduate nurses to be self-aware in our abilities as the newest members of the team and be able to be confident and ask for help when it's needed. For us as new graduate nurses, it's our responsibility to step up and be leaders. In order to be leaders, we need to be confident in our abilities and able to motivate others. As RNs, we determine, coordinate and provide safe, quality nursing care to our patients. The NMBA standards for practice hold us accountable for the decisions in which we make and the actions that we take. These standards heighten the importance for nurses to work within their scope of practice and only partake in activities that they have received accreditation for. When wards are understaffed or have inappropriate skill mix, it makes the work environment unhealthy. Team leaders or other staff members may ask you to do things that you have no experience doing. This is when errors and adverse events occur. As a new graduate nurse, you must do what is morally and legally right, and so ensuring your patient's safety by speaking up to your preceptors and team leaders is crucial. Using the New South Wales core health values, it is important that as a new graduate, we collaborate well within our team. As a new grad, it is important to be open on our communication in order to voice our concerns for patient safety, but also when we don't feel comfortable with performing a designated task. When communicating our needs, we should do so in a respectful way, ensuring that we're empowering our team to do what is best for the patient's safety. In all, through the research and guidelines that I've spoken about, it is clear that staffing is a contemporary issue that is leading to problems with both patient safety and a healthy workplace. Staffing affects patient safety as when wards are understaffed and have inappropriate skill mix, there is a greater risk of errors, complications, and length of patient stay. The issue also affects nursing staff by leading to burnout, the inability to finish assigned tasks, dissatisfaction, and the desire to leave the profession. I hope that this presentation has informed you as new graduate nurses of the incidents of staffing and the repercussions of not standing up for patient safety. If you as a new graduate are struggling with the incidents of understaffing, it's vital for you to speak to your preceptor, team leaders, and NUM. If further support or private counselling is needed, the hospitals run employee assistance programs which provide support in resolving any psychological issues. They also provide support in communication skills. So as a new graduate, if you are struggling, this is a support that may be utilised.